Good afternoon, everyone. Thank you for joining today's webinar, Combating Health Disparities Through Equitable Development. We're so grateful to the Build Healthy Places Network for joining us to share insights on the community development industry's role in our current moment, as well as how advocates for health and economic justice can better collaborate to address shared goals. We thank all of you for taking the time to learn and take action in your community. So I'm just going to take us through our agenda quickly and go over some housekeeping notes. So we'll start with Amber Hewitt, Director of Health Equity at Families USA, who will talk through why health advocates should care about equitable development. And then we'll hear from Ruth Thomas-Squant, Renee Bedruzaman, and Ashley Hernandez from the Build Healthy Places Network about collaborating with the community development sector to address shared goals. A couple of housekeeping notes. Today's presentation is being recorded. We will send the slides and recording to registrants after the webinar. And we will have a question and answer section at the end of the webinar, but please feel free to ask questions at any time via the chat function. With that, I'll turn it over to Amber Hewitt, Director of Health Equity at Families USA. So take it away, Amber.
Thank you, Lauren. And hello, everyone. My name is Amber Hewitt. I'm the Director of Health Equity at Families USA. Next slide, please. Families USA, we are a national nonpartisan health consumer advocacy organization, and we're dedicated to achieving high-quality, affordable health care and improved health for all. And our focus is both on healthcare and health because, as we know, medical care accounts for only 10 to 20% of health outcomes, whereas 80 to 90% are related to health-related behaviors, socioeconomic factors, and environmental factors. Our 4 pillars or focus areas are health coverage, healthcare value, equity, and also central to our work is centering the voice of health consumers and community members. Next slide, please. As it relates to our equity pillar, our vision for health equity is to ensure all families face no barriers to living a healthy life because of who they are, where they live, what language they speak, or how they identify. Our theory of change is to leverage opportunities presented by the moment that we're in regarding racial justice, the movement for health systems transformation, and the possibilities of transformative organizing to build community power and to develop federal and state public policies that address health and healthcare inequities. And when we say transformative organizing, we're talking about going beyond the goal of resource provision to fundamentally changing the community as well as larger structures to ensure the rights and liberties of groups and individuals and to realize a more equitable distribution of power. Next slide, please. As it will become clearer throughout this webinar, it's important to view health equity through a systemic lens. And if you attended our webinar in June on COVID-19 and health equity, this figure may look familiar. It was created by the Prevention Institute, and their trajectory of health equity model illustrates that disparities data alone does not provide social or historical context in terms of power and fairness. As cited in our Families USA report, The Fierce Urgency of Now, public conversations surrounding COVID-19 health outcomes have centered on the link between pre-existing conditions and health inequity, represented by the last 2 circles in this figure, rather than how differential rates of chronic conditions came about, how exposure such as community trauma, neighborhood disinvestment, and environmental toxins can cause or further exacerbate those conditions, and how these in turn are driven by inequities in political power and economic opportunities. This figure shows us that we need to widen our policy lens to capture the full scope of what's needed to drive health equity. And our partners from the Build Healthy Places Network will go into more detail on neighborhood disinvestment and the impacts of the built environment on health. Next slide, please. As an introduction to their presentation, I'd like to present findings from 2 studies which highlight how segregation and disinvestment fuels health disparities. The first is a study from the National Community Reinvestment Coalition, or NCRC, and their 2020 study on redlining and neighborhood health. And when we say redlining as cited in NCRC's report, we're referring to legal segregation, or the discriminatory practices which denied access to credit and insurance for borrowers in neighborhoods that were economically disadvantaged and or had high percentages of racial and ethnic minorities. As we know, redlining was widespread even in areas of the country that were not subject to the most extreme aspects of Jim Crow segregation. That's really important. So we aren't only talking about the southern part of the United States. The maps that you see here are from the greater St. Louis area. And the top left quadrant shows the HOLC score for this area. And HOLC stands for the Homeowners Loan Corporation. And this entity created these maps in the 1930s. This project was intended to provide a comprehensive assessment of mortgage lending risk. However, neighborhoods in which racial and ethnic minorities lived were almost always downgraded to the lowest of 4 classification grades, or known as hazardous, and shaded in red on the maps. And as you can see on this slide, NCRC's 2020 study found significant relationships between greater redlining and pre-existing conditions, in addition to greater redlining and the general indicators of population health. Next slide, please. Here you see 2 figures from our May 2020 study on COVID-19 and health inequity. In addition to providing state and federal policy recommendations, our report produced a county-level analysis across 11 counties that were at the center of national COVID-19 disparities and also have high Black and Latinx populations. Those counties were Cook County, which includes Chicago, Los Angeles County, all 5 New York City boroughs, Milwaukee County, Orleans Parish, which includes the city of New Orleans, Prince George's County, and Wayne County, which includes the city of Detroit. We used 3 measures for our analysis: the Robert Wood Johnson Foundation County Health Rankings, the Gini Index of Economic Inequality, and the Area Deprivation Index. The Robert Wood Johnson Foundation County Rankings, which you see reflected on the figure on the left, includes 2 composite scores, one representing how healthy counties are within the state, and the other composite measure, which includes a variety of health factors that takes into consideration healthy behaviors, clinical care, and the social, economic, and physical environment. The Area Deprivation Index, or ADI, the figure on the right on the x-axis, is a measure created by the Health Resources and Services Administration, or HRSA. And this measure accounts for rankings of socioeconomic status by region and is used by health systems, and providers to target program delivery, and a higher score represents higher levels of socioeconomic disadvantage in an area. This can also be thought of as a measure of how well resourced the community is, or the level of community disinvestment. And before I go into the data that you see in front of you, I will note that at the time of this analysis, New York City did not break down county-level COVID case rates by race or ethnicity. So you see on the left, counties that were ranked the lowest compared to other counties in their state by health outcomes were the same counties that had the starkest disparities in COVID-19 case rates. Similarly, the figure on the right, counties that had the highest level of deprivation or the greatest amount of community disinvestment were also the same counties that had the starkest disparities in COVID-19 outcomes. So what do these correlations mean for health and economic policy? As a starting point, they mean that the mechanisms that are driving disparities are political and economic and not biological, and that inequities are produced and they don't just happen. So going back to the history of redlining that we were discussing earlier. Next slide, please. It also means that equity is intersectional, and that we also must apply an intersectional lens to policy solutions. And many of you may be familiar with the term intersectionality. It was coined by legal scholar Kimberly Crenshaw, which you see on the right. And it is not the same as the multiple social identities that we all hold. When we say intersectionality or applying an intersectional lens, it means to look at the intersecting forms of oppression, how racism and sexism create a unique lived experience, for example, for women of color. Next slide, please. So we cannot talk about health inequity or health disparities without acknowledging structural and systemic racism. And this illustration sums up one of our key points, which is that health policy solutions must address access to health care and the factors that shape health in order to have the greatest impact. I'll now turn it over to our partners at Build Healthy Places Network.
Unmute myself. Thanks so much, Amber. So can you hear me clearly? So hi, everyone, and welcome to our session today. And thanks to Families USA for inviting us along today. We're really excited to talk to you about the community development partnerships and the new opportunities and resources that they represent. Next slide, please. So my name is Ruth Thomas-Gwantz, and I'm the Director of Field Building at the Build Healthy Places Network, and I'll be giving you this brief introduction to the community development sector. And we'll also hear from my colleagues Renee Badruzaman and Ashley Hernandez, who will tell you a little more about our place-based work, the policy work that we have going on, and some of the tools and resources that we have available. Next slide. So Build Healthy Places is the national center working at the intersection, really, of community development and health. And our mission is really looking to shift the way organizations work across the health, community development, and finance sectors. And the idea is to really collectively advance our missions and equity, reduce poverty, and improve health in neighborhoods. Next slide, please. And really, our work is done through engagement and education, and with the intention of really driving investments in equity that are focused on cross-sector partnerships that address social determinants of health. Next slide. So I won't be spending too long on this. A lot of you are very familiar and aware that health happens in neighborhoods. Next slide. And data has shown us that people, and Amber's data really highlights a lot of that the people get sick because of both their social and physical environments, and that health is intricately linked to where we live, work, play, grow old, and in other words, all those social determinants of health, and how they are inextricably linked with health equity. Next slide. The place really has such an impact on health and predicts your long-term health outcomes, such that you can say your zip code is more predictive of your health and well-being than your genetic code. Next slide. And the good news is that the community development as a sector is in the zip code improvement business. The community development goes beyond what we often do in public health of studying the social determinants of health to really being in the business of tackling them. And even in the past, I think they've not articulated their work or necessarily saw themselves as being in the business of health unless they were actually building a clinic. They do, however, address neighborhood and community level contributors to poor health. Next slide, please. So what is community development? Next slide. And I'll just be outlining this to begin by saying what community development is not. And so to undo the common preconception that community development is not the urban renewal of the 50s and early 70s. And this is an image that shows Pruitt-Igoe development that replaced dilapidated housing in northern St. Louis and was a jewel of modernist design in its day. While it was a state-of-the-art thinking at the time on how to get people out of poverty, it didn't last long and was actually torn down within 15 years. Next slide. So modern community development has learned from these areas, and today community development looks a little more like these examples. In these two examples, it is focused on comprehensive youth development, including things such as charter schools with the KIPP Academy in DC on the left, And Neighborhood Centers, Inc., which is based in Houston, Texas, which is a family health, provides early childhood education facility and a wide range of community services. Next slide. And this is just one more example that shows a workforce development program run by Thunder Valley Community Development Corporation that provides opportunity for Lakota youth to gain knowledge in sustainable construction while continuing their education. Next slide. So the work that community development tackles things like development and management of housing, financial coaching, employment training, childcare, community engagement and empowerment. They make them a really important partner in addressing the upstream social determinants of health. This work goes across the life cycle in that it will affect families now and in future generations. While they don't typically use that language in the community development sector, I think that is something that from public health we can recognize. And so these dimensions that go across the social determinants of health and from an individual level to a neighborhood scale makes for a pretty impressive scale of prevention that is provided by this sector. Next slide, please. And this slide is really just to illustrate briefly that community development and health are very often working side by side in the same communities. So the map on the right is a heat map of childhood obesity by city in LA County. And you can see the remarkable similarity to the heat map on the left, which is a map of economic hardship, which really directs the work of the community development sector. So effectively, these are almost the same maps. So we're working often in the same neighborhoods. Next slide. Okay, so we'll next take a look at a brief look at the community development sector, the scale, scope, and major players. Next slide. Oops. Wrong order. Going on to the next slide. So the community development sector, it is a pretty large-scale sector, and it represents about $200 to $400 billion that's invested exclusively in low-income neighborhoods annually. And I don't think it's much of an exaggeration to say that I come from a public health background, and many of us in the public health sector have no idea that this exists and that it's going on. About a third of this money comes from federal and state tax credits and grant programs. And while I won't have time to go into detail, and there's a lot of acronyms on there, I want to just give you at least to keep in mind that these exist when you hear them or if they come up. So you have the low income tax credit, which directs building of affordable housing, or LIHTC as they call it in the community development sector, LIHTC. The new markets tax credit is for investments in businesses that create jobs, including clinics, interestingly enough. Community development block grants are unstructured resources controlled by states. And then you have Healthy Food Financing Initiative, HFFI, which provides resources to build grocery stores in deserts. But the bulk of the money comes from private for-profit banks, and the big driver of this is the Community Reinvestment Act, which, if we briefly go back to just briefly to the previous slide. So many of you will be familiar with this. This is the federal law that's established to undo the sort of disinvestment caused by redlining, which Amber alluded to when she spoke earlier, that really has created the sort of disinvestment in communities of immigrants and also of minority communities. So if we can bump along 2 slides, please. Right, so I'll just briefly mention also the Federal Reserve System. So this is just to mention that there's a system, 12 regional banks, which may not think of as partners in this work, but they're really there, in that each bank is a community development office that's filled with staff that are involved in anti-poverty work, and their job is to promote new and established sources of community development finance for low and moderate income communities. So you can go and look up which regional bank your area comes under, and there are people there ready to talk to you about work to improve health outcomes in these communities. Next slide, please. And this is kind of a busy slide, but just to give you a bird's eye view really of the sector and a general impression. So CDFIs, which are on the left, they are called Community Development Financial Institutions, and they serve underinvested communities. There are over 1,000 of these in the country, certified by the Treasury, and they're all mission-driven to provide loans and services in low-income communities. And just to sort of name a few, there's the Opportunity Finance Network at the top and the CDFI Fund, and they're umbrella groups nationally for community development financial institutions. And then there are other sort of very national, large-scale enterprise and LISC and rural LISC, which are all CDFIs. On the right, you have the Community Development Corporations, or CDCs. They are non-profit, community-based organizations, and they typically focus on revitalizing low-income, disinvested neighborhoods and houses, as they call themselves, that build affordable housing. And there are some 4,500 of these nationally, and just a few are named here. And a couple of these at the top, like NeighborWorks America, are a national nonprofit that supports community development across the country. And the CEDA is the National Alliance of Community Economic Development Associations, again, an alliance of 40 state and regional community development associations. So it's a very established, mature, and large sector that are really partners in this work. Next slide. Okay, so we can shift to just take a quick look at some examples from the field. Next slide. So this is what does a sort of health partnership with community development look like, right? So this one this image is from Coatesville, Pennsylvania, and although it's located in one of the richest counties, 7% of the 7% of the population live in poverty, and Coatesville represents one of these low-income pockets. So the Brandywine Health Foundation wanted a permanent home, but decided they didn't want to have a one-story format, and they wanted to build a community hub. So this is an interesting multi-use example. The 4-story building actually houses health and dental services on the first floor, behavioral care on the 4th, and in between they have 24 units of affordable senior housing. So in addition, the project also created construction jobs locally and about 150 long-term jobs, as well as increasing foot traffic for local business in the area. So this $13 million project was brought about with a mixture of public and private funds. The affordable housing piece was funded mostly through the low-income housing tax credit, the LIHTC, which I mentioned earlier, and the center is also partially funded by a loan from the U.S. Department of Agriculture. So in addition, they also got a $1.5 million loan from the Community Lenders CDC, which are named at the top, and they're a community development consortium that lends to community development projects. So that's a great multi-use example. Next slide. So a slightly bigger city here. This is in Toledo, Ohio. And ProMedica is a large local healthcare system, and they partnered with LISC, which is the Local Initiative Support Corporation. And they're one of the large, big nonprofit banks. So again, investing in local and under-resourced neighborhoods. Together, they developed a $45 million community loan fund. ProMedica put in $10 million, mostly from their investment portfolio, interestingly enough, not from the community development dollars that we're more familiar with seeing. And LISC added $15 million of resources, and they raised the remaining money. And they could provide low-interest, affordable loans to the community. And if on the next slide, we'll take a quick look at one thing that they invested in was Market on the Green. Now, this is a grocery store that was built in the food desert, and it's entirely owned by the hospital, which is quite unusual. So they couldn't find a grocery chain prepared to come in and open it, so they ran it themselves with the help of an operator, and 5 years in, it has just broken even to become profitable. But the whole point was that it was addressing a social determinant of health identified in the neighborhood. So it was partially funded by a local philanthropist who provided money to create the EBID Institute, which is sort of named in the image there on the side of the building. And again, this is a multi-purpose building. It has a regular grocery store on the ground floor with healthy foods, and they do purchase locally sourced goods as well to wherever possible. And in addition, they offer on the floors above, they have a community kitchen with cooking classes, financial literacy, and a job training program that also supplies employees to the store. And they have a more expansive training program that does from state-tested nursing assistant courses with an aim to feed into the healthcare system. Next slide, please. So that was a great example of addressing sort of multiple social determinants of health. And in this example, this is a project from Hope Credit Union. Now, they're a community development credit union based in Mississippi. And in Yazoo City, Hope partnered with local housing authority, the state, the Federal Home Loan Bank of Dallas, and some private developers to build housing. And they put together $8.5 million to renovate 86 units of public housing. So Hope provided about $1 million in financing, just under $1 million in financing for that project, which created an affordable housing option that really fit neatly with the rural landscape of that community. So this development of Magnolia Crossing that you see here is not a multifamily high-rise, but it's actually a neighborhood of single-family homes. And they also partnered with the American Heart Association to increase access and to educate the community members about healthy food and other health issues. So next slide. I think I've thrown a lot at you, and if it's new, don't worry. I mean, it's a lot to take in, but don't worry about memorizing the details. But if you get a sense of this whole sector, let it settle in, and then you can always go to our website and dig in a little more to find how it can fit into your community and your neighborhood and where you're working. And along those lines, I really want to hand it over now to Renee, who's going to be talking to you a little bit more about our place-based initiatives and some of the policy work that we have going on at Build Healthy Places Network. So thanks, Renee.
Great. Thank you so much, Ruth. And again, thank you, Families USA, for having us. My name is Renee Bedruzman. I'm a program manager with Build Healthy Places Network. And we're going to be talking about our place-based initiatives and some of our emerging policy work. And as Ruth was mentioning, there was an opportunity to field build in this space, and we started to see more cross-sector efforts and more cross-sector partnerships, as the examples that Ruth had mentioned in Toledo, Ohio, with ProMedica and LISC and others. So what we did at the network is we started to develop tools and resources to support community development and healthcare partnerships. And Ashley will be going over in a minute some of what those tools are. And when we developed those tools, we saw there was an emerging need to support the implementation of those tools. So for the past year or so, we started to hone in on our place-based strategy and working with partners across the sectors to test, share, and refine our tools. And that includes partners within the healthcare sector, like a lot of you. And in our place-based initiatives, what we're working on is to connect with folks at the community level and provide that hands-on support to put together new projects and financing to actualize the resources needed and wanted by communities. Also to deepen our relationship with comprehensive cross-sector initiatives and support that linkage between health and community development at the local level. And so that includes understanding each other's language, right? Or how we talk to one another, breaking down silos, coordinating meetings, aligning visions and missions, and all of that great organizing cross-sector partnership work. Also, it was important for us to demonstrate that this work is possible on the ground in order to speed and scale solutions. So that great work we're starting to
push out or to amplify within our monthly newsletters, our blogs, our crosswalk essays. And that communications team who we have here on the call, Ruth and Ashley, are dedicated to sharing out that message so we can, again, speed and scale solutions. Next, connecting investors with investment opportunities that improve the social determinants of health in historically marginalized and disinvested communities, which are predominantly communities of color, due to the systematic racism that occurred within redlining and other policies that were talked about earlier on. And in that, we always are thinking about it with a ready lens, with a race, equity, diversity, inclusion lens, and bringing principles for building healthy, prosperous, and equitable communities forward with investors and with investment opportunities. And I'll go over a couple an example of that in just a minute. Also, within our place-based strategies and initiatives, we encourage healthcare investors, healthcare sector investments that address neighborhood determinants of health. And so that are the playgrounds and the green space and grocery stores and the food systems and transportation, all of those necessary components within communities and healthy communities that determine one's health. This could be also identified within the community health needs assessments that I'm sure a lot of you are familiar with, and that's actually a really key data point that we use with bringing together community development and healthcare in ensuring that we're meeting a community health need. And lastly, ensuring that those investments are equitable and community driven is very essential in delivering health equity. Next slide, please. And so I'll just share two examples of some of our place-based projects at Build Healthy Places Network. This first is a snapshot of landscape analysis that we did for Coachella Valley, San Bernardino, Santa Rosa, and Stockton in California. This was a part of our Blue Shield of California Foundation grant. And a first step to developing a healthcare and community development partnership is this process of a landscape analysis. The goal is to showcase community bright spots, their resilience and their strengths and assets, as well as highlighting the health and social inequities within particular geographic areas. So we're getting down to the neighborhood level types of data that community development works with regularly. And then we identify some potential health partners and community health partners, initiatives, their priorities, their pain points, some investment history, and other available sources of financing. And really these landscape analysis allows us to assess potential partners to understand their motivations and resources and to analyze those opportunities, the gaps, and the challenges to move potential partnerships forward. Next slide, please. And one example of that was our work with Intermountain Healthcare, which is a nonprofit integrated healthcare system in Utah. And I think there's a larger region in Utah, but this was focused primarily for Utah, where we supported the formation and the development of an affordable housing preservation fund for the state of Utah. This is a really exciting opportunity for us because they wanted to capitalize the fund at $100 million, and they already raised $40 million for this fund. And what you see here on the screen are the principles that we help develop and support with the principles that we have on our website for building healthy and prosperous communities, but that match their local need. And that considered what the community needed as well as the investor landscape and community development landscape in the state of Utah. In this process with the project, we also conducted a landscape analysis, but we did a national scan of analogous funds and created these fund principles from that process. So we got to kind of see what were the opportunities to create a fund that was started from healthcare and invested into affordable housing preservation. Next slide, please. And so now I want to talk about our emerging policy work at Build Healthy Places Network. And this is part of our Healthy Neighborhood Investments project. And these policies are identified to connect community development health. And our goal with this project is to identify policy actions that make it easier for healthcare and community development to jointly invest into racial equity and the social determinants of health. And specifically, we're looking for policy innovations, barriers, and solutions, as well as leadership opportunities within the healthcare system to create more conducive environments for cross-sector collaboration and advancing the social determinants of health. This policy scan is done at the federal, state, and local levels, and we're partnering with the Shift Health Accelerator Consultants Group to help build this policy scan and action framework. Next slide, please. And so our hypothesis in this scan and scope is that there are already existing policy innovations that we can build and adapt from other places. And so we're looking at the local planning policies, environmental justice policies, a wide range of social, environmental, and contextual policies in this scan. And we need a menu of strategies that support removing barriers, that incentivize innovation, and require best practices. And we see the opportunity here to organize with community coalitions such as Families USA and encourage state health systems and community development to deepen their innovation for social determinants of health. And as we know within COVID, as we see the inequities, the health inequities continue to exacerbate, that we need to continue to highlight that these types of innovations and driving health equity are what we need to do to move forward. And the end product of this project is a scan of the policy landscape. Right now it's a pretty big document, which I'm really excited about to share with you all. And then the policy action framework will be specifically focused in on California. That's where we're located and where our funders from Blue Shield of California Foundation are. And so with that, I'd love to turn it over to Ashley to bring us into some resources and next steps and how you can get more involved with the network.
Yeah, thank you so much, Renee. My name is Ashley Hernandez, and I am the Communications and Outreach Specialist for the Build Healthy Places Network. And I'm going to talk to you today about some of our resources. So now we know that there's this exciting sector called community development. And by partnering with community development organizations, we can do things like accelerate investments towards the spread of innovative solutions to build healthier communities. And now at this point, you may be wondering, well, how do I actually get there? Next slide, please. So Build Healthy Places Network has some tools to help guide you. Definitely check out our website, buildhealthyplaces.org. It will have all the resources I'm covering today and more. And make sure to sign up for our newsletter, The Pulse, to stay up to date on our work, as well as what's happening in the community development and health sectors. Next slide, please. So our first tool is the Jargon Busters. So as you can imagine, finding common language that we can use to communicate between sectors can be a challenge, even when we share the same goals. So our tool, Jargon Busters, will help you navigate industry lingos. So if you find yourself lost in a sea of acronyms, this can help clarify some common industry slang. So now you won't be in a room filled with a bunch of folks from the community development sector and wonder what they mean by CDCs. Now you know. Aha, it's Community Development Corporation. Next slide, please. So now you have a better handle on how to communicate across sectors, but this still may feel a little abstract. So you want to see a concrete way that community development and health sectors can partner. Well, check out our playbook. It's an action-oriented guide and a go-to resource on the community development sector's role in addressing the social determinants of health. So it's a tool that can really help start the conversation on potential cross-sector partnerships by addressing some of these questions. So for example, who are the players and what are their motivations and offerings? What's the evidence that makes the strongest case for community development and health partnerships?
what do partnerships currently look like? How do partnerships develop? And what are the barriers to building some of these partnerships? Next slide, please. So now you have the jargon down. You understand concretely how these partnerships happen. And now you want to find those potential partners. Who are the community developers working on issues like affordable housing in your state or your neighborhood? Definitely look up our Partner Finder. It's a collection of directories to help you find the community development organizations nearest you. So for example, you can find a rural LISC, which is a CDFI, or NeighborWorks America, it's a CDC. And both these organizations have a member directory that will point you to their member organizations in different zip codes across the country. Next slide, please. So you are moving along this journey and you have your cross-sector partner identified. And now you need to make the case that community development and health partnerships are strongly positioned to address health equity in your community. Bring along our fact sheets to that conversation. These fact sheets, developed in partnership with NeighborWorks America, takes a closer look at the common aims of the community development and health sectors by focusing on some of the most persistent health challenges in our communities. So for example, we have one fact sheet focused on social isolation, another on mental health, and very soon we will be adding an additional fact sheet focused on homelessness. And each of these fact sheets presents evidence and shares case studies to really illustrate the power of cross-sector collaboration to improve health equity. Next slide, please. So now let's talk about the takeaways from this presentation today. So first, learn. Utilize these Build Healthy Places networks resources that I just described. These resources will help you navigate the community development sector. And then identify. Use our Partner Finder to locate the CDCs and the CDFIs working in high poverty areas in your communities. Then engage. Reach out to the community development organizations. Invite them to participate in activities like the development of a community health assessment or the community health needs assessment. Join the board of a CDFI or a CDC, or ask someone from a local CDC to join your board. As Ruth mentioned, what's important is not knowing every in and out of the community development sector. What's important is that you're building these partnerships. And then align. Consider, how can you align your organization's resources and expenditures with those of local and regional community development organizations? What are your common goals? Where are your shared neighborhoods of concerns? Again, as Ruth mentioned, there are billions of dollars in annual community development resources. These partnerships can be really instrumental in ensuring that those investments go to neighborhoods and communities most in need. Next slide, please. Thank you so much. We know that there's a lot of information that we've just presented today, but if you do have any questions along the way, again, make sure to check out our website, buildhealthyplaces.org. You can also follow us on Twitter or find us on LinkedIn. And of course, if at any time you have any questions, please feel free to reach out to Ruth, Renee, or myself. We would be more than happy to connect. And thank you so much again. Next slide, please.
Great. Well, thank you so much, Amber, Ruth, Renee, and Ashley, for sharing your expertise with us today. So we're going to move into a question and answer session. We're already getting some questions, but if folks have a question, please enter it into the chat, and we will get to as many as we can. So the first question, I think I will pose this to Renee, and if others have have thoughts to chime in. But how do you choose a community organization to work with? And this person is particularly thinking about a public-private model to integrate health service into Section 8 public housing.
Great. Thank you so much, Lauren. Thanks for the question, Ray. It's a good one. Something that we look for when we begin partnerships or engagements is really an ecosystem of ready partners. for example, like it sounds like you're working with, you perhaps maybe already working with your local public housing authority. That's a really good opportunity to connect with the local government, right? As well as perhaps the economic development department and the public health department and perhaps key players within that space. Within the community development side, we also like to ensure that there is a health strategy and leadership buy-in to understanding that the social determinants of health are a priority, right? That's I think an essential component when we're working deeply within community development corporations, is that leadership buy-in is there. Also, I mean, we know from conducting a study of community development corporations that staffing for this type of work is particularly challenging. So when they do have the buy-in, when they do have the staff time, they are usually quite ready to engage in a partnership long term. And I will say most of these community development corporations and healthcare are looking for a long-term sustainable partnerships. And then looking for those shared goals among those partners. So understanding within like the local healthcare context, local CDCs, local government, where are the shared goals and opportunities? Where are the, we work a lot with, CDCs, so we ask them what are their healthcare priorities, what are their pain points, what could you help with, right? What could that value proposition be? And then, and this is something that that Build Healthy Places Network supports, is a knowledge of the local landscape. So kind of doing an assessment and understanding the history, the culture of a place is really essential and really important, because we want to cultivate and build long-term sustainable relationships and partnerships between community development and healthcare. So that's what I would, I think, say an ecosystem of ready partners is usually how we identify groups to work with.
Great, thank you. And I would also add, this is Lauren, just that if you are working with a CDFI, they are a community development financial institution or a community development corporation. They have a rigorous process with the government for certifying that they're primarily working with underserved and under-resourced communities. That's very different from traditional financial institutions. So you know that you're working with a really mission-aligned organization from the start, and I think from that it's really digging into alignment between your organization and your goals and their organization and how they're set up to address those shared goals. Another question, sorry, I'm just reading through them, is around public health and prevention. And kind of how these types of partnerships can ensure avoidance of ACEs, which I actually, I'm coming from the Community Development Organization. Amber, could you jump in and define ACEs for the group? And then I think I'll put this question to whoever wants to address it.
Sure. So adverse childhood experiences, so that could include things like domestic abuse, childhood neglect, different forms of trauma.
Great. So I think if anyone has an example of a partnership or how partnerships between community development and public health organizations can address the prevention of adverse childhood experiences.
Hi.
I can jump in. Go ahead.
Oh, sorry.
Go ahead.
Yeah, I was just going to say, I don't have a specific example in mind, and one thing Renee and I have both found in a recent project is that there's not a lot of quantified evidence about investment. I think it's intuitive that by improving safe housing, healthy housing, and the factors that support a healthy lifestyle would help improve outcomes. But we don't have, there's a real lack of hard data out there. So if anybody does want to do that study, that would be great, and please do let us know. But I do think that a lot of the ACEs, they're so linked with the environmental, the social, the safety, policing, all those sort of factors that will feed into creating an environment. I think that community development's role in creation of what I just call environments that support health have an impact on the ACEs. But I'm going to let Amber speak.
No, I was just going to say that's a great question. It seems to be some white space there. So when we talk about adverse childhood experiences, we should also think about it in conjunction with adverse community environments. And Dr. Wendy Ellis, who is affiliated with the Washington, D.C. University, that's escaping me right now, has done work on that area about the pair of ACEs. So I think looking at her work would be helpful, because we know that these adverse childhood experiences happen within the community context, and there is research looking at community stressors on different health outcomes. But as far as a specific study or an example, one doesn't come to mind. But I think we should. I love that question. Whoever asked it, I'm happy to think through it further with you.
I think it's a great question, and I think what they haven't done is the step further to show direct investment, in community infrastructure, and then trace that, out. I think it's a logical dotted line, and I think it's important because we've shown that the absence causes the the injuries, and what we just haven't shown is that we can really impact that and reverse it and address those traumas.
Thank you. The next question from Allison is about funding for these types of projects that address the social determinants of health and have both health and community resources. So this particular question is about collaborating with community partners to write grants. I think that we can also talk about other types of capital in addition to grants as well. But just kind of how do folks that are interested in health equity start to think about funding for these types of projects, and what are some of the options?
That's a great question. This is Renee. I can start. One of the opportunities that we've done to support this type of partnership has been to usually kind of let the community take the lead, the community development corporations, that is, onto where they're looking for funding, and then support through letters of intent, or letters of support has been one way that we've been able to kind of support them in that process. But again, I think that's a good point, Lauren, that the grants are one funding resource, but the other is a capital, and that's what community development corporations and community development financial institutions are also really well versed in, and can support more investments into the community through different partnerships.
That's a great question, as you say, Renee. And just to back up, this is Ruth. Also to build on that, and I think, Lauren, you probably can back me up on the details of it. I think like the new market tax credits that I mentioned, some of those things are actually competitive. So something that a health system, a public health organization can do that can actually help a community development corporation is to lend that influence of saying, well, yeah, actually this is important for health. This is going to change health in our community. And so it's actually an asset to sort of bring that kind of community health data and knowledge to the community development sector. So, you know, there's also contributions you can make beyond money, which can access funds.
Definitely. Thank you, Ruth. So another question we have is around how folks on this webinar can use policy and advocacy to help catalyze change to address some of these inequities, and are there particular policy levers that have been successful?
You want to take that one, Ryan?
Another great question. This is something that we're starting to be more involved in as far as Build Healthy Places Network. And one of the policies that we've been in support of is the Community Reinvestment Act. And there have been regulatory changes that have come up to kind of weaken or lessen those provisions. And Lauren, you will know a lot more about this than I would. So I'm sure if you can speak to this, but that's an opportunity that we want to continue to cultivate, because it incentivizes for-profit banks to invest into the communities of which they're taking deposits from. And those being low-income communities, again, that are predominantly of color. And so that's the Community Reinvestment Act is an opportunity and one of those policy levers.
Yeah, so, and I think there's so many, I mean, this is such a complex environment. You know, the economic system, the health system are very complex, but I would say if there are two really major policies that folks should be aware of, one is the Treasury Department CDFI fund, and that's where community development institutions get that actually grant funding as well as low-income capital to help support this work. So it's really critical. 2016 was the first time that the administration suggested actually zeroing out that fund, which has traditionally been quite bipartisan in its support. So it's critical that folks are just aware of the impact of these sorts of organizations and that fund particularly, and talking about continuing to invest in the CDFI fund. And the other is our colleagues at Build Healthy Places Network has mentioned is the Community Reinvestment Act, making sure that we both protect and strengthen the Community Reinvestment Act. You know, it was passed in the 1970s. There were some updates in the 1990s that really catalyzed additional investment in community development financial institutions and community development corporations. And it's critical to make improvements upon that foundation rather than rolling back, you know, that really important resource that is supporting these sorts of projects. So you know, we would be happy to share more information on that in future webinars. I know that folks have received a lot of information, so I would just, you know, encourage folks to keep learning, to start building relationships with organizations in your community that are really the experts in this work, and learn how you can kind of build off of each other's expertise. I think that we are still getting some great questions, and we will follow up on any questions we weren't able to answer, being respectful of folks' time. But thank you to everyone who joined this webinar. We really are grateful for your interest in this issue. We hope the tools and information that we shared today will help you take action in your community. We've summarized some of the key resources on this slide, and again, we'll send this around to everyone who registered for this webinar. If you aren't already on our email list, we encourage you to join familiesusa.org/sign-up. And we also will be sending around a survey to this webinar, so we're really interested in any other resources that would be useful for you, particularly with respect to addressing the social deterrents of health and partnering with community organizations. So feel free to share any suggestions with that survey. Thank you again to everyone who joined. Thank you again to our speakers. Really appreciate your insights and your engagement. And we hope you have a wonderful rest of your day.